Hi, I'm Dr. Lee, and today we are going to go over the female reproductive system. This is MBC 201, Unit 6 lecture. The objectives of this presentation are to identify the organs and other structures of the female reproductive system, define and spell the word parts, build and analyze medical terms using word parts, define, pronounce, and surgical and complementary terms for the female reproductive system, interpret the meanings of the abbreviations, and read medical documents and interpret medical terminology contained in them. So the female reproductive system function is to produce the female egg cells and hormones, and it provides for conception and pregnancy. So here are the organs of the female reproductive system. So you have the fallopian tubes, you have the ovary, the sigmoid colon, the uterus, you have the cervix, you have the bladder, the pubic bone, the G-spot, the clitoris, the urethra, and the vagina. So this gives you a different view of the reproductive system. You can see how the fallopian tubes serves the ovaries, so it connects to them. And then you can also see how everything goes through the uterine area. And then you have all the blood vessels, obviously, that supports it and goes out through the vagina opening. So the ovaries are a pair of almond-shaped organs located in the pelvic cavity, and they have the egg cells that are stored in these ovaries. Females, unlike men, are born with a set amount of eggs. And these eggs do die out over time, and they usually have a shelf life of about 40 to 50 years. You have ovum, which is the ova, that's a female sex cell. Then you have the fallopian tubes that are a pair of 5-inch tubes attached to the uterus, and that provides a passageway for the ovum to move from the ovary to the uterus. Now, the female breast is connected to the female reproductive system in that once a female is pregnant, the breast does begin to form milk. And upon the birth of the child, it is able to then give milk through the mammary glands to that infant. Now, the uterus is the pear-sized and pear-shaped muscular organ that lies in the pelvic cavity. Now, during pregnancy, obviously, it goes from pear-size to large enough to house that baby, up to 10 to 12 pounds sometimes that the child can be. The functions are obviously for menstruation, pregnancy, and labor. The endometrium is the inner lining of the uterus. The myometrium is the muscular middle layer of the uterus. And the perimetrium is the thin outer layer of the uterus. Now, the corpus or body is the large central portion of that uterus. You have the fundus, which is the rounded upper portion of the uterus, and the cervix is the narrow lower portion of the uterus. The vagina is a 3-inch tube that connects the uterus to the outside of the body. And the hymen is a fold or a membrane that's found near the opening of the vagina. Now, you have the rectus-uterine pouch, which is the Douglas cul-de-sac pouch, and it's between the posterior wall of the uterus and the anterior wall of the rectum. And lastly, you have the vulva or the external genitals, and those are 2 pairs of lips. You have the labia majora and the labia minora, and it surrounds the vagina. The clitoris is a highly erogenous erectile body located anterior to the urethra, and the perineum is a pelvic floor in both males and females. So here are the fallopian tubes that we talked about earlier. And there are some surgical procedures that are performed on the fallopian tubes depending on the need to perhaps remove a blockage, or if there's an occlusion that needs to be done, or if there's an affected area of the tube, then you remove that entirely. So salpingectomy is the removal of the affected tube entirely. Salpingostomy is a surgical incision to remove the blockage. And then tubal ligation, it permanently blocks a section of the tube. And obviously that results in not being able to have a child. Now, endometriosis is caused by a lot of different things, but it's basically inflammation of the fallopian tube. Sometimes it is caused is genetic reasons. Other times it's from nutrients or the diet of the particular person, and it causes severe pain and severe bleeding. Oftentimes, mammography is necessary for women that are 35 and older. Just to check, it can be done annually or every other year, to check for any presence of lumps, whether they're benign or malignant, and it's an early detection method for breast cancer. And that concludes this presentation.